Good afternoon, everyone on the call, and Happy New Year. Please, may I be heard and can my screen be seen?
Yes, please. Good
Okay,
afternoon. Many happy
okay,
returns.
thank you. So today I'm going to give a talk on cervical cancer, and I believe with the cancers you've heard about breast cancer, prostate cancer, those are the common ones. Cervical cancer is equally as important and just as devastating within our Ghanaian population. And it's one of the ones that are most preventable, as Portia mentioned. Early detection really can save lives. So we'll go through my presentation. I'm going on to slide share mode. So this is just a word map that I found on the internet, and it's very colorful, but it has some very potent words. It had something for us to, at the end of the talk, things that should ring with your memory. You should remember screening. We're talking about prevention and infection. There's hope, which is a very large word because there is hope. Once we're educated, we're empowered and we can take actions to protect ourselves, protect our family members, and the community around us. So today, my presentation is going to take this format. I'll have an introduction. I'll go through how the disease spreads and the epidemiology, what we know about it in our global and local setting, and then also talk about how it comes about, how this cancer comes about, what are some of the risk factors and causes, what are the signs and symptoms, what will you see with an individual who has cervical cancer? How do we go about diagnosing it? So the evaluation, and then just briefly talk about management, what the modalities are. And then prevention is going to be the bulk of my presentation. Then I also briefly talk about some of the guidelines or that are in place to help us enforce these rules for prevention and our conclusion and then a take-home message. So, as we all know, cancer, basically, when we say cancer, is a group of abnormal cells wherever you find them in the body. They are usually cells that have a normal function. But when they become cancerous, what happens is the normal cell cycle that regulates how the cell is going to divide and the function it should perform goes out of sync. And so when you see cancer anywhere, it's just abnormal cells. So with cervical cancer, the portion of the body that is affected is the cervix. And the cells have different functions, what they do at that portion. Now, with the cervix, we can locate that at the bottom part of the uterus or the womb, and it opens into the vagina. So, for women who have had a visit to the gynecologist, there's a special exam that we do. Some women have been told to examine themselves. So, what the cervix feels like is firm, is like the tip of your nose. So even if you don't have a cervix, if you touch the tip of your nose, that's how it feels like. So it juts into the lower part of the vagina, and that's the entrance to the womb. So usually during menstruation or during childbirth, there's an opening there that lets blood out, and then for during childbirth, that's what dilates to let the baby out. Now, cervical cancer can affect anyone who has a cervix. So, in this age of things with gender, we're talking about women who have cervix. This next slide is just giving you a diagrammatic representation of the female reproductive system. So, we're going back to basic science or general integrated science lecture. So, you see over here, you have the ovaries, you have the fallopian tube, you have the womb, and this is a cross section, so they've cut it in half. Then you have different layers of the womb. So you have the muscle, which is the myometrium. The lining is the endometrium. That's what's shed um, every month when you have your menses, the lining over here. Then the lower part over here, where my cursor is, I hope you can see, is the cervix. So you see, this is the whole uterus or the womb, and then this lower part is what we call the cervix. So they have specialized glands that produce secretions. It has a protective feature, so it produces mucus. This mucus at certain times prevents sperms from entering into the womb. It also produces lubrication, some lubricants effects. Um, During the mid part of the cycle, you see that for some women, they see something that looks like an egg yolk. These are substances that are produced by the glands in the cervix. And then this is the lower part of the birth canal or the vagina. We're all adults here, so some of the things that I may show or say are a bit graphic, but that's just to illustrate the point better. Now, this picture on the right over here is showing a diagram of a cervix that has been affected with cancer. So I have another picture on the next slide that shows the normal cervix, and then we have one that is cancerous. So when we do the specialized exam, we see some of these lesions when uh, the person has cervical cancer. So you see the cells are abnormal. Usually this is a very smooth um, surface, but you see it's very rough and then irregular. So this is another picture. So the picture on your left over here, where my cursor is showing somebody who is having a pelvic exam. We have a special instrument called the speculum. It can be either metallic or plastic. So this is inserted into the birth canal, the vagina, to be able to see the cervix. The cervix is high up, so if you don't do that, you won't be able to see it very well. So this is a normal cervix. You see that it's the lining is pink. There are some patches that are white. There's a dot in the middle that just shows the opening. And then the picture we have on the right here is an abnormal cervix, which has a cancer. So you can't really even see them if you compare the two. Uh, there are areas that it's a large lump. You can't see the opening. There are some areas that are red because there are more blood vessels and so on. So why are we making so much noise about cervical cancer? It is one of the leading causes of mortality among women. And this information is coming from WHO. And we collect data from different countries worldwide to collate some of these pieces of information that we give you. In terms of cancers among women, it's one globally, it's the fourth most common cancer, and about 90% of new cases or deaths worldwide were found to occur in low and middle income countries. And this is largely because of lack of awareness, and we're not screening, uh, so we're not catching them early. Now, in Ghana, cervical cancer is the second most frequent cancer among women, the first being breast cancer. In 36 countries, one research done showed that it was a leading cancer death. And it's something that in low and middle income countries, again, it's three times higher a cause of death from cancers as compared to those in high income countries. As I'll tell you later on, but a lot of countries have developed programs that have been running for decades for vaccinations, for screenings for women. So they catch it early. So it's not that those cancers don't occur, but people don't die from them because it's caught early and it's treated early. So in 2019, the center that collates information about HPV found out in Ghana about 2,200 deaths were due to cervical cancer. That's in women in Ghana. Now, GlobalCon is basically an observatory for all cancer-related morbidities and mortalities in the world. And as I mentioned, we found out that for cervical cancer, globally, per the 2022 data as fourth. So that's what we have over here. So for females, and then for both sexes, it ranks a bit lower. In Ghana, for females, breast cancer is number two. I told you that breast cancer is number one and cervix is number two. So in 2022, the number of cases that were recorded, that's 3,072. And these are the ones that report, to the health facilities. We have people who suffer from these cancers. And as we all know, in our cultural setting, we are very spiritual, so they might seek help elsewhere, not necessarily report to the hospital until it's too late. Now, in terms of the pathophysiology, or how does it come about? Most cancers, you will hear us saying we don't know the exact cause. We can't pinpoint. We have risk factors. But cervical cancer is one of the cancers where research has shown that it's linked to a virus. And this virus is called the human papilloma virus, which is abbreviated as HPV. So if you hear me saying HPV, that's the human papilloma virus. And more than 95 or 99% of um, cervical cancers have been linked to this virus. This virus is very common. It affects the reproductive tract, and um, cervical cancer is by far the most common HPV related disease. Now, this human papilloma virus, as I said, we have several types. It causes different diseases, not just cancer. So you hear things like genital warts. Genital warts is a sexually transmitted infection. So somebody might have a swelling in the genital area. It's firm, it's not necessarily oozing, it's been there for a while. That may be genital warts. That's not cancer. It can also cause, so a lot of times people hear, well, HPV, it only has to do with women. No, HPV affects both men and women. And in men, it causes penile cancer. For those who engage in homosexual sexual activity, it causes anal cancer, both in men and in women. If you're having anal sex, that is a risk. It also causes oropharyngeal cancer. So, oropharyngeal cancer is just basically a cancer that affects the tonsils, the back of the throat, the base of the tongue. So, you are having, if somebody is performing oral sex with someone with who has HPV, you are not using a condom. That is how that is introduced into the throat and the mouth. So it's not just about the cervix when we talk about HPV. Now, the two common strains that are responsible for most of the cancers that we see are type 16 and 18. I bring this because I'll talk about the vaccines later on, but we have so many different numbers. You don't need to keep that in your head. But the 16 and 18 are the ones that are known to cause most of the very aggressive cancers and the precancerous lesions as well. Now, as I mentioned, the human papilloma virus is transmitted through sexual contacts. And I have to say that most people are infected shortly after their initial sexual debut. So if you're having unprotected sex and there's some sort of sexual contact, it's it's something that a lot of people catch. But with most viruses, if your immunity is quite good, you're able to clear it. Now, you can also infect somebody without penetration. I believe we're all adults, so I have to be very candid with the way I explain things. A lot of times people think that, oh, well, if there was fondling and the person has uh, how do I say, they've touched themselves and they touch you, then there's no risk of contracting any STI. Now, if the person has HPV and there's skin to skin contact, but not necessarily penetrative sex, then you can have that transmission of the virus. And then it's not necessarily through the exchange of bodily fluids. So that's what we have to remember. So some people might get the infection um, there are some groups of people that get the infection that it might be through sexual abuse. So children like this can get the infection, and it's as a result of sexual abuse. The highest prevalence of cervical HPV among women in sub-Saharan Africa is 24%. With male prevalence, it's variable because it's based on the sexual trends, and collecting that data is a bit difficult because people in our culture it's taboo to talk about sex, so you might not always get the actual information on what the sexual practices are for us to pinpoint the risk factors. Now, as I mentioned, most sexually active individuals will be infected at some point in their lives. Some may also be repeatedly infected. So, if you are practicing risky behaviors, each time that you are having sexual intercourse without protecting yourself adequately, you are increasing your risk of catching the virus over and over again. As I mentioned, 90% of people will clear the infection. And the risk is that for all women, the infection may become chronic or precancerous. For women, as you look at the anatomy, for women, things are deposited in the reproductive tract as opposed to men. So if you are exposing yourself over and over again, the virus has enough time to manipulate your system and override the things that would clear it. And then eventually it's there for a long time and then changes occur. And the thing about this is that it takes 15 to 20 years for the cancer to develop in women when you have a normal immune system. So it's very slow growing. It's there. That is why we want to talk about the screening later on, because something that takes 10, 15 years, 20 years, if you're screening along the way, you would catch it and be able to do something about it. For women with a weakened immune system, such as those who have HIV infection that's untreated, you might have other um, conditions, chronic conditions that have led to a weakened immunity, things like diabetes. If you're on medication that suppress your immune system, then this time is shorter for women. So this is just a graph to show you how the infection goes on and the normal progression with age. And then with in terms of the years as well. So imagine they use 15 years because a lot of the studies show that by age 15 years, uh, a lot of people have had some kind of sexual activity that exposes them. So if you're looking 15 years from that, if at 15 you started having sex, you are having unprotected sex, multiple partners, and so on, the risk is increased. So by age 30, if you've been repeatedly exposed to the virus, if your immunity is down, there's a increased risk that around that time, then you are also showing the precancerous lesions, and then later on, by the time you're in your 40s, you can have full-blown cancer as well. So, what are some of the risk factors? I put this on top because that is the world that we live in now. Men who have sex with men, a lot of times these sexual encounters, because it isn't the way biology was intended, there is a lot of transmission of STIs, and there's risky behaviors involved. I mentioned immunosuppressed individuals. So those living with HIV have a 6 times more chance of developing cervical cancer, and especially younger women, because I mentioned the factor about age. Then I talked about certain medications. If you're on chronic steroids for different health conditions, if you're undergoing cancer treatments, all infections you are most likely to catch, so that's another thing. Then you also have, if you have other sexually transmitted infections, so that also means that the you've been diagnosed with, let's say, chlamydia, gonorrhea, and so on. There is a risk that you have contracted HPV. Then I mentioned children who have been through sexual abuse. So this is both um, you are still talking about both sex, that is heterosexual and homosexual practices. Then unsafe sexual practices, I talk about having, so koitaki is the age at which you first have a sexual encounter. So having it early, multiple sexual partners, and then smoking. Smoking in any cancer increases your risk. Now, what are some of the features that you might see? So, in the beginning, it might be very, when you have the human papilloma virus, the infection itself, it's, you might not see anything. It might be, I mean, you don't feel, oh, you're not losing weight. The early changes, what we call the precancerous lesions, also may not cause any symptoms. So the person is fine walking around. In very early cancer, and things that you might see is bleeding. So, bleeding that is irregular. So, somebody might have bleeding when it's not time for their menses yet. So, halfway or a third way to after they've had a week or two after they've had their menses, they are bleeding. Not to say that every irregular bleeding that you have is cervical cancer, but once you have some kind of bleeding that is outside the norm for you, it has to be investigated. Then we have postmenopausal bleeding. So we have women who have had their menses for 5, 10 years, and then all of a sudden they start bleeding and they think they're having their menses again. This is not normal. Cervical cancer is one of the causes. There are other cancers that can cause that, but that always has to be investigated. And sometimes people feel that the bleeding has to be a lot. It has to be so much that you're wearing a pad. Some of the old women will tell you they just put a bit of toilet roll in their underwear. It can just be a brownish discharge, but it's as long as it's something that you didn't have, you know, 2 years prior, 5 years prior, 10 years prior, and it's come up again. It has to be investigated. Some people also have bleeding after sexual intercourse. That's the postcoital bleeding. So they might think that okay, maybe they had a very um, vigorous encounter, so that's why they are bleeding. But normally, you shouldn't bleed after sexual intercourse. Then you have the discharge. So HPV normally causes a discharge, which is increased and offensive. And then caution here, not to say that every discharge is due to HPV. For women, we have what we call the normal physiological discharge, and then we have those that mean that you have some sort of infection. So if you have an increased discharge or something that is offensive and you're not sure, your best bet is to go to a health professional who has been trained to know the difference and to request the appropriate screening tests to find out exactly what is going on. Then in advanced age, when in an advanced disease, when the cancer has spread, it spreads to within the pelvis, it can spread to the back. So somebody has very bad back pain that is not going down. They have leg pain, they have pelvic pain that they can't explain. It's not associated with their menses, it's there all the time. Then we have things like the weight loss, you're tired all the time, and the loss of appetite. Then there's the offensive and copious discharge. Now, for those of us who are trained, when somebody has cervical cancer, and they come into your consulting room, even before they tell you, you would know. There's a very peculiar smell that comes with the discharge. Then it can spread into, it can compress on blood vessels and spread into lymph nodes. So you can have leg swelling. It can spread to the brain. You have seizures, loss of consciousness, and then eventually death. Now, how do we evaluate this? How do we diagnose cervical cancer? Every cancer in the world, before somebody tells you that this is cancer, they should have taken a bit of the tissue, the area where is suspected to have cancer, and it should be taken to the lab for the pathologist to look under the microscope and to do specialized tests to tell you that yes, this is cancer. So it's the same for cervical cancer. You may have the features, the signs and symptoms, but until we take a bit of it to the lab, we can't say that for sure whether this is cancer or not. And we have something called staging. I have a diagram that explains that. So when we find that there's cancer, We can tell you whether it's early or late, and which stage it's at. It's based on how big the tumor is, whether it has spread, where it has spread within the body. How do we evaluate or diagnose this? So, apart from your pelvic exam, so we have a colposcopy. It's basically imaging of the vagina and the cervix. And then we take a biopsy. So a biopsy is just taking a bit of the tissue, a little sample of it, we put it in a preservative and we send it to the pathologist. Then we also do imaging. So you might have a scan done, you might have a CT scan, an MRI, and then we have our metastatic workup. So because of the areas where it spreads and all that, we do things like we check your full blood counts. We might check to do a scan. We look at your liver. We might decide to check the brain, the back areas where it would spread to. So we do imaging and then blood work as well. Now these diagrams are just showing you how the clinical exam um, goes on. So the first one on the top left, you see um, there's a physician in her lab coats, and she's going to perform uh, the colposcopy. So the lady is lying on her back, her legs are in the stirrups, and she's going to use the device she's holding, the colposcope, to visualize the cervix very well. This device at the bottom here, this plastic device, it looks like the bill of a duck, if you see the duck. So this is what we call the speculum. So this is a disposable one. So the disposable speculum, so that you can insert this into the vagina. You open it up. It's quite uncomfortable. So we do this so that we can visualize the cervix, because the cervix is located deep in the vagina, the upper part of the vagina. Without this, we will not be able to see it very well. Now, the diagram over here just shows you the different staging. So this is the normal cervix. The uterus, you have the cervix and the vagina over here. And then the different stages. So in the beginning, it's just, at the lowermost end, and then it spreads upward. It spreads into the soft tissue adjacent, and then it keeps going. So when we do this speculum exam, this is what we see. And this helps us to tell what stage we are at with the disease. Now, how is this managed? So, for management, it just depends on where the stage of the disease. I always would say that early detection saves lives. So, if you catch it at its very early stages, the precancerous stages, when it's at the very tip, there are different things that they can decide to do. So, we have surgery and all that. As it advances, we might have to do radiotherapy. So, radiotherapy is using radio waves to kill the cells that are multiplying at a high rate. Sometimes the radiotherapy might be that it's spread too far, but we want to stop the bleeding. And we also have chemotherapy as well. And these different modalities will be decided by your gynecologist or your oncologist, what would best suited for this your condition at that time. So we also have palliative care. A lot of times you hear people say that, oh, well, um, the cancer may have spread. There's nothing that can be done. Well, with palliative care, the plan is to improve your quality of life. So they manage the symptoms, any pain and suffering due to the disease. It's not aimed to cure. So we have that option available as well. So the Kolebu Polyclinic has a palliative care unit. In the event that you have any relative who has um, sort of cancer that you've been told it's not treatable and you want to know the next steps, you can always contact the team so that we facilitate care with the palliative care unit as well. Then we talk about prevention. Now, prevention, as we know, is better than cure. And they say a stitch in time saves nine. Cervical cancer can be cured if we are diagnosing it early and is treated promptly. In our setting, what we find out is that some people may um, have signs early, but they ignore it or they're not sure what it is because of where the issue is. There might be some embarrassment, but you should be able to talk to anybody. I mean, you should be able to open up because it's your health. It may be nothing, but I think a lot of times now with the information that we're seeing on social media, when there's something little that happens to us, we think we go to the worst case scenario. And for some people, their default is to run away from it. But I think um, because we have this knowledge that if we catch it early, we can treat it promptly and it can save lives. If you know anybody or if you are experiencing things that are abnormal, anything that I've mentioned, please let us get you the necessary help. Now, this prevention is comprehensive and it's a multidisciplinary approach. So we have in prevention, we have primary, secondary, and tertiary prevention. So with the primary prevention, that's what we're doing now. We are in health everywhere. We are moving away from just curing diseases. For family medicine physicians, one of our mandates is to promote preventive health. So we want to empower you with the knowledge so that you can make good choices so that you don't develop the disease at all. So we are going back to the ABCs in terms of safe sex. So condom use is important. It doesn't offer total protection, but at least it reduces the risk of getting HPV, and then thus reducing your risk of also getting HIV and reducing your risk of getting cervical cancer. Ideally, full coverage of the genital area is preferred, but the female condom doesn't have a lot of traction in terms of that, but that would be the ideal. So full coverage. Then delaying in starting sexual activity for youth. So for the parents out there, you should be having that talk with your preteens, the adolescents. So from age, this is no longer you don't wait for them to be in Form 1. By Form 1, they know more than you sitting there. So giving them, having a frank talk with them, not the talk to say that no hanky panky, no sex, no. Inform them what exactly goes on, what are the risk factors, open the lines of communication for your children, for your nieces, for your nephews, for members in church, mosque, wherever you find yourself around young people. You have to help them to know the benefits of delaying sexual activity in youth. Then reducing sexual partners. So as I mentioned, ABC. So abstinence, if it is possible, being staple to your sexual partner, and then condom use. Then general practices, just things that generally help you have better health. So watching your diets when the new year, I know some people have made very long lists, things that they're going to stop eating and stop doing. Don't lose the vim or the momentum. So having healthy diets, a lot of whole foods, vegetables and fruits, drinking enough water, physical activity, trying to put in about 30 minutes or 45 minutes of some physical activity in the day. Stop smoking if you do. Stop drinking or reduce the amount of alcohol you take. And then good health seeking behavior. So you've been informed. I'm sure if I have a poll of how many people have had the cervical cancer screening ever, it will be very low. But if I say breast cancer screening, that might be a bit high. For in some countries, male circumcision reduces the risk. So places like South Africa, they encourage male circumcision. I think in our setting, most of the males, um, because of our cultural practices, are circumcised. Then the next thing is um, the HPV vaccination. As you know, Ghana last year we rolled out the vaccine. So the cancers can be prevented with the vaccination. and it's one of the easiest or the best ways to prevent the HPV infection. So we have WHO has currently four pre-qualified vaccines, and they are all protecting against 16 and 18. So these are the different types. So vaccination is ongoing for our young females and then males as well. Now the vaccines are safe and effective, and they've been around for some years. So a lot of surveillance and research has gone into it. So that is why we are also rolling it out so that we can get those comparable numbers to the those in higher income countries. Now, usually it's preferred that the vaccine is given prior to any onset of sexual activity. So that's why the age group they are looking at those 19 to 14 years, because the assumption is at that time they may not have started any sexual activity. But even if they have, it still doesn't negate the effect of the vaccination. Now, we have to remember that the vaccination does not replace the cervical cancer screening, which I'll go on to next. So the secondary prevention is the screening. So we want to catch those who are asymptomatic, and we want to create the awareness before it spreads. So there are screening tests that are available, and it's one of the only cancers that have screening tests available. So we basically do the screen to check if for the disease, even though there are no symptoms, or to find it in the very early stages before it has become cancerous. So there are certain changes that you see, and this is when treatment can work best as well. Okay, so what are the screening methods? We have there are three main screening methods that we have. So we have the visualization under acetic acid. Acetic acid is basically vinegar. So there's a chemical reaction that goes on when vinegar is applied to the cervix that is able to tell us that there are some changes going on when we observe. So this is usually, sometimes it's used in low resource settings or when we have mass screenings. The gold standard would be using the pap smear. So the pap smear is we scrape a bit of the cervix. I'll show you a diagram of that. And then it's put on a slide and then we take it to the lab. So then the pathologist will look at it and tell us that there is whether there's cervical cancer or not. There are other things that they can um, observe from that smear, but that's the main goal of that. Then we have the human papillomavirus DNA or mRNA test. So that test actually is able to detect if that infection is there. So now you have some of the screens where you do both the pap smear and then the test as well. Now, when we have a positive screening result, so we refer to facilities that are able to further manage whatever condition that may be. So you might have HPV and then you're under surveillance. You may find precancerous lesions, and then depending on what stage it is, there'll be some management as well. I said, remember that both when it's asymptomatic, when you have the HPV infection, you may not have any symptoms, and the precancerous lesion may not have any symptoms. But it's the regular screenings that are able to check your cervical health. So for women, that it's recommended that you have the screen starting. So it's 5 to 10 years at age 30 because of how long it is. Women with HIV, it's a bit shorter. Now, I'll also go into the different, depending on the screen that you do, there's a variation in the interval. So regular screening, I told you, is essential in preventing. And they say only about 1 in 4 women haven't been screened. But if I was to take a poll, I'm sure in a setting, the numbers would go up. It wouldn't be 25% haven't been screened. It would be a larger number. This is just a diagram to show you how the speculum, the pelvic exam is done for the screening. So The woman is lying flat on her back. There's the speculum, which I showed you, the disposable one is inserted, and then we have a brush to touch the cervix to collect a few cells, and then that is transferred into a container and sent off to the lab. So over here as well. So the lying on the examination bed in the stirrups. So this is the brush. So you have the cytology and then for the pap smear. So this brush you see usually is dipped into a container with fluid, a special fluid that preserves the cells and is sent off into the lab. So when it's inserted and then they twist it around several times to get the sample and then it's put in the container. Then this is for the pap smear. So the pap smear, you see that there's a long, flat spatula wooden swab stick that is inserted. Then the physician turns it around and then they smear it on a glass slide and they send it off. So what are some of the screening recommendations? So this is based on American Cancer Society guidelines, and then we also have the American College of Obstetricians guidelines. So we have for less than 21 years, no recommendation okay, but then we also have if based on the onset of sexual activity as well. Then for 21 to 29 yes, you can either do the cytology or the pap smear alone. So every 3 years, that is recommended. If you do in age bracket, those who are 30 to 65, you can do both the HPV um, testing, which is the DNA testing, and the cytology. If you do the two, then the period increases, so it's 5 years. But if you do just either the cytology or the pap smear, every 3 years you're supposed to uh, recheck. For women over 65 years, if the previous screenings have been negative, they check your risk assessments and it's not high, you don't have to do the screen. But if you are over 65 and you've never done it and you know uh, it's good to just do it and then have that out of the way as well. Now, how do we manage I mentioned precancerous lesions and then suspicion of cancer. So with the precancerous lesions, we have things to manage. So we say ablative treatments. So it's basically the cryotherapy is they freeze it's because it's a very small portion. There's a special instruments that uses nitrous oxide. So they freeze that area or they use heat to kill that area. And both treatments are effective and safe. And it's usually performed as an outpatient procedure. You're not admitted for a long time. It's done as an outpatient, you're observed, and then you are discharged. But then if there is a suspicion of cancer based on the screening, as I mentioned, we have to refer you to the right level of health services for proper evaluation. And in each case, the treatment is designed based on where the stage of the disease. In a nutshell, let's remember that it takes 15 to 20 years for cervical cancer to develop. That's a long time. And the early changes with the precancerous lesions usually don't have any symptoms. But with screening, we find the disease when there are no symptoms. And the screening can also detect the disease at early stages where the treatment, um, in terms of the treatment, the potential for cure is very high. And screening can prevent cervical cancer. And let us also not forget the vaccination, which is available now for our young ones and it is you're not being charged for it at the public facilities. So we raised awareness. That is the first step. The next step is to make sure that there's early detection, which is a lifesaver, and then to screen and we want to protect all the lives on this call. So remember that a world without cervical cancer is possible. And the ribbon, the color, so you know the of pink October. So maybe next year we should have teal January. So the color for cervical cancer is teal. I don't know whether it's a sea green or a blue green. The men always argue that we have some fanciful colors. So this is the ribbon for cervical cancer. And remember that a world without cervical cancer is possible. Yeah. These are some of the sources that I use. So thank you so much for your attention. Um, I'll pause here for any questions that you may have.
So thank you very much, Dr. Susan, for this insightful session. And so members, please, we're opening the floor now for any questions, any comments, any concerns. Dr. Susan, we have some few in the chat box I want to read out. Um, okay, so
I've seen,
can
um,
a virgin get infected with the virus, please?
okay, so when you say virgin, remember I was quite explicit in the ways that it's transmitted. So it is not necessarily penetrative sexual intercourse. Somebody will say they're a virgin because they haven't had penetrative sexual intercourse, but um, if you have oral sexual intercourse, you can introduce the infection through the fluids I mentioned, but not for cervical cancer. If there's no skin to skin contact, so there's something the young people do called brushing. So they don't necessarily introduce the penis into the vagina, but the two sexual organs are rubbed, and if that person has the HPV virus, you can actually contract genital warts and so on and so forth. So sometimes we have to be very technical in terms of what we uh, classify as virginity.
Okay, thank you, Doc. So the second question is that how many shots are required for the vaccine?
Okay, so it depends on the age. Currently, I know GHS, I believe they're only doing one. It's supposed to be two. If you have it earlier, in some cases they do three shots. So for right now, they're doing one. I don't know when the second, in terms of the coverage, I don't know when they're planning to do the second one. But if you are going to do it on your own elsewhere, it's usually two shots, and then they have to also look at your age as well. So all those factors uh, have to be considered. Is it for you or is it for somebody younger?
Okay, Doc. So we have some few questions coming through from our YouTube channel. And they are asking which health facility in OT region can we visit for the test or the vaccination?
Okay, so the Medical Women's Association puts together some facilities that are doing the screening. Um, I would have to, if you give me a minute, I'll look to see if there's one in the OT region. I probably also have to share that, find a way to share that to Portia so that you can have it. So if you give me a minute, I'll just look on my phone and see if I have the one for OT region.
Okay, so Elom is asking if the vaccination is free.
So the one they're rolling out for the young people is free, yes.
Okay.
Yes.
So we have
Eh,
another question from Florence Omari. She says, if someone has cervical cancer but no symptoms, can it lead to infertility?
That's so usually because cancer suppresses the person's immunity, it may at that time, usually when you have any chronic condition, and that's not the ideal time for your body to conceive because it takes a lot of resources out of your system. But when you say infertility, uh, in this uh, case, it's a bit You can't say that the cancer is the cause of the infertility. It might be difficult for the person to conceive at that time because they are not well, but not necessarily causing infertility. I hope if that answers your question, or if you can elaborate a bit on that.
Okay, so her follow-up question says, once someone has taken the vaccine, does that mean the person will never be infected?
It reduces your risk of getting the HPV infection. That's what it means. So it's just like uh, with any vaccination, it's supposed to increase your immunity. You produce enough antibodies so that even when you get in contact with that virus, you're able to fight it off. So it increases your immunity. Uh-huh. And as I mentioned, with the human papilloma virus, a lot of people get in contact with it and they clear it naturally as well. So with the vaccination, that ability to clear it is increased. So it doesn't mean that you never, if you take the vaccine and you're having sexual intercourse without using a condom, or you're having sexual intercourse with multiple sexual partners, you will be exposed to uh, the virus.
Okay, so we have another question that says, how does pregnancy and childbirth affect cervical cancer
How does pregnancy and
and
child
childbirth?
affect? So, in terms of risk factors, in Africa, they found out that your the we have something that we say parity. So the increased parity, if you have more children, that is considered a risk factor in terms of that means there are multiple instances where you've had unprotected sexual intercourse. If the partner you are with has the HPV virus or keeps infecting you with it, that increases your risk. In terms of um, pregnancy, it doesn't really have, it's the childbirth that is what is a risk. But uh, pregnancy just means that your immune system is, you know, is suppressed, is down because of the baby. But it's childbirth, though increased childbirth. A lot of studies show that uh, when we look at our women who have it, what are some of the risk factors? Women don't smoke. Generally, if you ask, uh, when I interview a lot of people in the clinic, most of them don't smoke, but they may have had a lot of children, so that increases your risk.
Okay, so can a pregnant woman undertake the test?
No, so for this, you're talking about for the screening, no, it's usually you can do it afterwards. Because it's not that invasive, but at that time, it's not recommended. Then, also for the vaccination, when you're pregnant, you can't have the vaccine. You would have to have it afterwards. Then, some things to add about the screening. So, if you're going to do the screening, there are a few do's and don'ts. If you are currently in your menses, you cannot have the screen done. If then about 24 hours prior to having the screen, you should not have any sexual activity because that would interfere with the results. So those are the two things that you should know.
Okay, so the next question says, for 15 and 14 years old, how many shots are recommended?
Okay, so it's currently they're doing the first round, but it's supposed to be two. So it's supposed to be two shots. So I think they'll announce when the second round is going to be done. But walk into any neighborhood, any of the health facilities. I think I have to provide the list of facilities that are it's available at so that you can have that done for them. And remember, both males and females. The tendency is to focus on the females.
Okay, so Angela is asking, the vaccine was for my children. They took it 4 years ago at age 13 and 15, and it was a single shot.
Okay. For Angela, can you tell me which um if you have their card, um which vaccine they had? Or you can always Portia will give you my number backstage so that if you don't have it with you, so we can look it up and then see.
Okay.
Mhm.
So will vaccination for the kids continue this year?
So they right now I think the going from school to school has halted, but they have health facilities that you can walk in and have it done. So if you are in Accra or in other regions, you just have to find out from the neighboring public health facilities that have public health units. That's where they are administering the vaccinations.
Okay, so another question says, what risks or side effects are there to the treatment? Are, are these things, can these things reduce these side effects? Are there things to reduce the side effects?
Okay. Emmanuel, are you talking about in terms of managing the cancer? Are you talking about the difference to radiotherapy and chemotherapy and surgery? Or you're talking about the vaccinations?
All right, Emmanuel, we are still waiting for your feedback. Doug, does the vaccine expose one to cancer, please? Sometimes we hear that when you take a vaccine, it exposes you to diseases or somewhat. Can you please
No.
explain further?
Okay. So the vaccine does not contain cervical cancer. So the vaccine that you're getting is to stimulate your immune system to fight the human papilloma virus infection, which we have found to be one of the major causes of the cancer. So when they give you when we give you vaccines do not necessarily give you disease, but they are modified portions of things that how do I say it? So let's say for this, the HPV vaccine, they've modified uh, portions of the virus that stimulates. It's like they take a bit of it to stimulate your immune system. That's how most vaccines work. So they don't take the cancer and then put it in the vaccine. No, it's just to stimulate so that when you are exposed to the infection, you already have the arsenal to fight whatever is coming in. So you create antibodies within your blood so that you're able to fight it. So it doesn't, if you take the vaccine, it doesn't mean that later on you are going to get the cancer. No, it's so that you can fight the human papilloma virus.
Okay, so the next question says, I was informed that if you are above 30 years and sexually active, when you take the vaccine, it is less effective and it reduces your risk. And there's no need to do that. How true is that?
Yes, but you can still go ahead and take it. So some guidelines say they give the cutoff as age 45 and 42. So if you really want to take it, you can go ahead and take it. It's not as effective because at that age, you've been exposed multiply. It's possible that you've been exposed, you've cleared it, you have gotten some kind of immunity yourself. So it doesn't have the same effects as somebody who is 10 years who would have multiple vaccines so that um, before they are even exposed to the infection, they can, clear it faster. But I mean, age 30 years you can. It's just that based on the research that has been done, it doesn't show that it's as effective as somebody who's in their teens. Yes, but some guidelines go up to age, they'll tell you in the early 40s, 42, 45. So if you really want to uh, take it, I mean, it's totally up to you. It has some benefits, but it wouldn't be as high as somebody who's much younger.
Okay, thank you, Doc. Can the screening be done whilst one is on oral contraceptives?
Yes, please. The screening can be done. You just can't do the screening when you are having your menses or if you've had sexual intercourse 24 hours prior. So the night before, 24 hours prior, you can't really have. It's not indicated to have it. Okay.
Okay, so what should be the intervals between the first and the second shot? For my case, this was November last year and January this year.
Okay. Let me cross check that for you. So then November last year, so December, January. So that's 2 months, isn't it? Uh-huh. I'll just cross check that for you. I know they have a system that they're doing because they want to get better coverage. I'll have to let me just cross check with that and give you that information in a bit. Emmanuel, you said yes, please. So is
Mm.
that yes, please? I asked two questions, whether it was to the surgery, chemotherapy, radiotherapy,
Okay.
or it was to the vaccine. If you can clarify for me.
Emmanuel, please, you can unmute and talk. We are here. Okay, so Doc, he says for the vaccine.
Oh, for the vaccine. Oh, okay. So the side effect for the vaccine is just like any vaccination. So you might have pain at the site. Um, some people some people faint when they have the vaccine, but there are not any very serious side effects that are, like the fever, malaise. uh, Those are some of the things. So they tell you that just like any other vaccination, if you're going in and you are not well, you have a cold, you have malaria, whatever it is, it's better to abstain. And then pregnant women cannot have the vaccine at that time.
Okay, so we have the last question in the chat box, which says that please, can you go through the treatment again? If you do the pap smear and it comes out positive, what next?
Okay. So if you do the screen, so you're doing the pap smear and it comes out as positive. So the next step is not to panic. So you go when you get a pap smear and it's positive, we give you a referral. So we'll give you a referral to a gynecologist, a facility that will able to what do you call it, handle whatever it is. So usually they might decide to, let's say you went for a regular health screening and then they did it and it was positive. So they would evaluate you, they take a history, some of the labs that I said, and then we take the next step before we say that this really is cancer is to take a biopsy. So the screen is just telling us that, okay, this infection might be there, these cells are abnormal, then the precancerous stage or the cancerous stage. We take a biopsy of that area. So for the pap smear and with the cytology, they just kind of lightly brush the area and we look at it under microscope. But this one, they'll take a bit of the tissue and then they take it to test. They also do a deeper pelvic exam, if it's something that has spread, then we do the workup. So based on what is found at that time, if really it is in the precancerous stage, I mentioned they might decide to just burn the area that is involved off either with heat or with cold. They might decide to do a little surgery. If it's more advanced, then you have other things like the chemotherapy, might have a more what do you call it, a more detailed surgery, we may have radiotherapy. So if you do the pap smear and it is positive, your first thing is just to ask for a referral to a facility that is has the capabilities to further investigate and then manage this.
So, Doc, yes. So Nana is asking whether the screening is covered. It's covered under the GHIC policy.
Nada, unfortunately, the screen is not covered. The test is only covered if there are actually symptoms or indications. So that is how it works. Yes, if you actually have, symptoms that are indicated, and then that can go on. But the screen is not covered under the insurance package. Okay.
All right. So Florence is asking whether can a pregnant woman get cervical cancer whilst pregnant?
It's possible. It's possible. So same way as some people can get breast cancer while pregnant, it's possible.
How frequent should we do pap smear?
So for the pap smear, based on the results, if they are normal, they'll usually tell you every 3 years you come for a repeat. If something has been found or before that time, if there are any symptoms that you're having, you can go in sooner. If you do the pap smear or the cytology together with the HPV DNA, that's every 5 years.
Please, do we have any other questions, concerns, clarification?
So those in Greater Accra, some of the places that are having the screening, Kolebu Teaching Hospital, the Reproductive Health Unit, Ridge Hospital, University Hospital Legon, Airport Women's Hospital, Mary Stopes, Chip Compound, Bediaco, Medicas, Divine Grace, Ga East Hospital, Shai Osudoku, that's Dodowa, 37, Oyibi Health Center, Katamanso Health Center, Apollonia Health Center. The Somebody asking the OT region, just 1 minute, let me pull up and give you that information.
Okay. All right. So we want to take this opportunity to thank you all for joining this insightful session. And we want to also say a very big thank you to Dr. Susan Keteku for availing herself to educate us on cervical cancer. We want to inform you that the recording is on our YouTube channel and all our social media handles. When you go there, you get the recordings from there and you can listen to it again. We also want to encourage you, if there are any other issues you would like to speak to any of our medical advisory team, you can please look behind your GAP health card. There are numbers there when you reach out to us. Our team of medical expertise will be readily available to give you all the clarifications you may need on any of the conditions. So thank you once again, and we want you to know that GAP Healthcare you can bank on, and we are always there and available for you. So on this note, we want to say a very big thank you once again, and have a good evening. Thank you very much. All right.
Thank you everyone for joining, and remember, go get screened, create awareness, watch the video again, share it with a colleague, ask your friends, your girlfriends. We've checked our breasts. Have we checked our cervixes? And you can always reach out to the team if you have any further inquiries or you need help navigating anything. Thank you and have a good night.
Please, where can we get a video, a playback to what?
I think she mentioned the YouTube, Portia, the YouTube link. Is it in there? Okay. Can you share the link so that they can?
Yes, please. The link will be shared to you pretty soon. Thank you.